la série Startup en 5 questions. L'équipe Eurêka rencontre aujourd'hui Kelly Perlman, directrice des recherches chez Aifred Health. Donc, j'ai 5 questions pour toi aujourd'hui. Tout d'abord, est-ce que tu peux te présenter et nous présenter ta startup?
Oui, absolument. Hi, I'm Kelly, the Director of Research at Aifred Health. And at Aifred Health, we're using artificial intelligence to bring personalized medicine to mental health. So what that means is that we're creating a software that will help doctors match the right patients with the right treatment.
Pourquoi votre entreprise est-elle nécessaire pour la société et les gens en général?
Okay, so 1 in 9 people will suffer from depression, and actually depression is the leading cause of disability worldwide. So it's a social burden, but also an economic burden. In Canada, for example, the cost of depression economic burden is about $32 billion a year. And one of the reasons that treatment for depression is so inefficient is because doctors use a guess and check approach to trying treatments. So basically, they'll try one treatment, and if it doesn't work, the patient will have to come back a couple months later, and the cycle keeps going until the right treatment. So patients can try to find the right treatment for years before they find something that works for them and helps to relieve their symptoms. So what we are thinking is if we can get the right treatment for a patient the first time, that would help alleviate so much suffering and would eliminate the stress burden of trying to find a treatment.
En quoi pensez-vous que votre startup se démarque?
So we're really trying to do something that has not been done before. Depression and mental health in general is a very complex field, socially and biologically, and it's a hard problem to tackle. So we're an interdisciplinary team composed of computer scientists, neuroscientists, and clinicians, doctors, and we're trying to bring all that knowledge together to build our solution. So we're very focused on the science, which I think sets us apart a lot from other just AI companies. We're focused on really the biological science, and one of the cool things that we're doing is actually we're going to have the very first ever clinical trials for an AI system in mental health.
Qu'est-ce qui vous a poussé en fait à lancer une entreprise qui combine technologie et santé mentale?
Great question. So for me personally, I have a background in neuroscience, and so I learned a lot about mental health and mental illness in class from basically like a biology standpoint, but they would also talk about why it's so complicated and the burden, and sort of give it a little bit of a clinical lens and show what's the effect that it has on patients. And every class would end sort of like, this is really complicated and a lot more research is needed. So there wasn't ever really a solution to bring it. Also, I had become interested in computer science, so me and a couple of other people that I knew, friends, we came together and thought of this solution that would bring together deep learning, so artificial intelligence, with this huge unsolved problem of mental health. And so for a bunch of different reasons, just scientific interest, some people on our team have personal experience, just the general realization that there's a hole that needs to be filled, a problem to be solved. We came together, and I think we're a team that really can solve this problem.
Puis, quelle est votre opinion du programme Startup en résidence de Desjardins?
This program has been absolutely amazing so far. I cannot say enough good things. Aside from the space that we get here at Naughman, we have access to so many amazing programs and services. For example, we just had a presentation on the best legal services for a startup and what we need to know from that respect. We have pitch training so that we're more comfortable pitching in front of investors. We get to meet a bunch of cool people from Desjardins and other places that come in to talk to us, and I think that it's unlike any other program that exists, and I feel so lucky that we get to be a part of it.
Super, merci beaucoup pour ton temps.
Merci beaucoup à vous.
Puis au plaisir de voir votre startup progresser dans la santé et les technologies.
Merci.